Now, there's a lot of benefits, but there's also some potential risks with testosterone therapy. And you scratch your head and you say, well, you know, it's a hormone, it's a normal hormone made by your body anyway. Why should it have any side effects to it? Well, the Women's Health Initiative, postmenopausal estrogen in women, 20 years ago we used to think it was great. We put every woman on it. And it does help with certain aspects of women's health. But it also increases the risk of breast cancer. It can increase the risk of stroke. It can increase the risk of clots, of other problems as well. So it's not without its risk. And the same thing's true with testosterone replacement. It does have a couple of risks to it. You can get fluid retention. Okay, not a terrible thing. We can deal with that. You may get increased blood counts. Athletes will sometimes dope with testosterone. 2 years ago, the American cyclist who won the Tour de France had his title stripped. They found extremely high testosterone levels in his blood, and they found out that he was doping with testosterone. The reason why athletes will do this is if you take testosterone, you'll boost your blood counts. You boost the red blood cell count in your body, therefore you can carry more oxygen. You can cycle better at a higher altitude. Okay? Now, if you take this to the nth degree, you can actually get such high red blood cell counts in your blood that your blood starts to turn kind of almost like syrupy, and you can get clots in capillaries and small veins in the body. Okay? So you may get increased blood counts that are dangerous. Prostate health. You may get some enlargement of the prostate with testosterone replacement. If you have urinary obstructive symptoms, you've seen all the commercials on TV, gotta go, gotta go, gotta go right now. Well, these men sometimes have an enlarged prostate and they can't empty their bladder completely. If that's the case, your bladder doesn't empty and you've got to empty it more often, so you're not necessarily peeing more, you're just peeing more often but smaller amounts. And testosterone therapy may make this worse. You may get some breast enlargement with this. Boys, when they go through puberty, their testosterone levels skyrocket. What happens to some of that testosterone is it's converted into estrogen in fat tissues in the body, so your estrogen levels go up a little bit. And some boys can actually get a little bit of breast development as they go through puberty. This usually resolves over time. The same type of a thing can happen in men when we start testosterone therapy on them. We may get some mood fluctuations. You know how teenage boys are when they go through puberty. They can be a little moody and a little edgy and a little bit irritable. Some men may get this from time to time. It's like going through a second puberty. Growth of prostate cancer. Now, to my knowledge, there's not a single study showing that testosterone therapy causes prostate cancer. But if a man has an underlying prostate cancer and we put him on testosterone therapy, it'll grow. Okay, so it's one of the things we monitor for with rectal exams and with PSA blood count testing. Okay, so when a man's on testosterone therapy, I typically recommend a rectal exam every 6 months for the first year and then yearly thereafter. Okay, because much of prostate cancer is picked up on rectal exams. So testosterone therapy does have benefits, but it also has some potential risks to it as well. Now, another common thing is erectile dysfunction. Okay, and I really want to stress again that erectile dysfunction just does not mean low testosterone, and low testosterone does not mean you're going to have erectile dysfunction. Erectile dysfunction can be caused by a list of things this long other than testosterone deficiency. So I'd like to say a couple of words on erectile dysfunction because this is a very common thing in men. And the reason why I asked who in the audience is over the age of 50, because this is a pretty significant statistic. 1/2 of all men with diabetes over the age of 50 have some degree of erectile dysfunction. 1 out of 2. So you're in common company if you are over the age of 50 and have diabetes. Risk factors for erectile dysfunction: uncontrolled diabetes, high blood pressure, and high cholesterol. Again, there is some degree of vascular insufficiency in erectile dysfunction, and some of that is due to underlying cholesterol problems. Smoking. If you smoke, you gotta stop. I don't think there's ever been anything proven that smoking improves your health. If you find it, let me know. And it's a major risk factor for erectile dysfunction. Again, low testosterone, but again, low testosterone does not mean you're going to improve your erections 100%. Obesity, stress, alcohol, and other drugs. Some of our blood pressure medications that we use for blood pressure may have a side effect of causing erectile dysfunction. Talk with your doctor if you think any of your medications could be causing it. Okay? So, if you have erectile dysfunction, how do we treat it? Well, if you smoke, stop smoking. We control your diabetes, your high blood pressure, your cholesterol, kind of the ABCs of diabetes. Steve Mishka is going to talk about that in a little bit. Limit your alcohol use. If there's a lot of alcohol being used, limit it. If there are certain medications that can potentially cause erectile dysfunction, talk with your doctor about that. As far as medicines to treat erectile dysfunction, we do have some oral medications. We've all seen them advertised. We've all heard the jokes about them. Basically, there are 3 of them on the market: Levitra, Cialis, and Viagra. All work fairly similarly. And I put up here that many may respond differently, meaning I've seen a lot of men have good success with one, but the other one didn't work. One works sort of, the other one didn't work. So a lot of times we do a trial and error type of a thing to see how men respond to it. Okay? You do have to watch blood pressure problems because these medications can lower your blood pressure pretty significantly if they're used with nitroglycerin or nitrates. So talk with your doctor who prescribes this to say, is there any interaction with my medications? Also ask your pharmacist, is there any interaction with my medications for a low blood pressure? Other therapies, if the oral agents do not work, if the Cialis, the Viagra, or Levitra do not work, a lot of times we'll use other therapies such as injections of prostaglandins into the base of the penis. That causes dilation of blood vessels and an erection. The idea of giving yourself an injection in the penis before intercourse is not enticing to many men, but it does work. We also have urethral suppositories of prostaglandins. It kind of does the same thing as the injections, but what happens is you take a small little tablet, put it into the urethra, meaning the tube where urine comes out, and that medication gets absorbed into the penis and causes dilation of blood vessels and an erection. If neither of those work, we do also have vacuum devices that we can use, and these work in about 95% of all men. So there are some significant improvements that we can have in erections for men. A lot of different treatment options, and the vast majority of them are going to give you success. Okay, we may have to go down to the end of the line, meaning a vacuum device, but 95% of men with erectile dysfunction from diabetes will respond with that. Okay. Again, if the testosterone is low, treating it will help to some degree. But I've also seen this kind of backfire. I've seen some men with erectile dysfunction and a low testosterone. We replaced their testosterone, improved their testosterone, their sex drive went up, but their erections didn't get any better. And now they have the sex drive, but now they're more frustrated because they don't have the means to do anything with it. The other thing is the emotional impact of erectile dysfunction. No man wants to have this, obviously. And if you do have erectile dysfunction, it can lead to significant problems with depression, anxiety, stress, and lack of self-esteem. The other thing is it can create significant marital challenges or challenges with your spouse or significant other. What can you do? A couple of little tips. Realize that this is a health problem. A lot of marriages could go through some struggle with this because they think, well, he's not interested in me anymore. Well, men can sometimes be scared if they're having erectile dysfunction, scared about, geez, am I going to be able to function? So then they avoid sexual activity. And then the spouse thinks, well, they're not interested in me anymore. And therefore it creates a lot of discord between the couple. So share your feelings with your partner. Say, this is a health problem. It's not that I'm not interested in you. I still find you very attractive. I still love you very much. But this is a health problem. And many times your partner will understand. Okay? And work together with your doctor to find reasons why you have erection problems and why you have testosterone deficiency, because there are some significant treatment options. So what I tell people is kind of take the bull by the horns with regards to this and get some help. So in summary, diabetes in men is on the rise. Okay? 11% of all men over the age of 20. It's probably going to be upwards of 15 to 20% in the next 10 years. I think I read a statistic not too long ago, 57 million Americans have pre-diabetes, meaning they're at very, very, very high risk of developing diabetes in the future. Some risk factors for the development of diabetes are correctable. Again, we can't correct our genes, we can't correct our ethnicity, but we can correct weight problems, we can become more active, eat healthier, etc. Diabetes can lead to a number of complications, including sexual dysfunction in men, both low testosterone and erectile dysfunction. Again, 1 out of 2 men over the age of 50. Okay? Good treatment options do exist, both for testosterone deficiency and for erectile dysfunction. Great therapies exist for the other complications of diabetes. I'm not going to go through them because Steve Mishka will. And then, again, you must take the first steps with regards to this.